Madam Moderator, and also our wonderful esteemed participants here today of the Integration of Knowledge of Human Sciences. I'm so happy to meet all of you again. And just like last week, can I invite you to be very interactive in the chat box? I love to hear from you, and I would love to share with you a little bit of knowledge about this particular topic that is very close to my heart, and that I think all of us need to actually have some insight about it. I think crisis is something not new to us. All of us might have faced a crisis in some ways, right? Sometimes there might be some experiences that are traumatic. And remember, a traumatic experience for me might not be traumatic for someone else, just like a traumatic experience for someone else might not be traumatic for me. So whenever we are helping someone in a crisis or in a problem or in a trauma, it is good if we do not make a comparison as to, the most common term or response we can hear sometimes from people is, oh, that's not so bad, I've had it worse, or this person had it worse. We mean well, and sometimes it's helpful to hear that, but sometimes we might undermine what the other person is saying. So today I want to share with you some techniques of how we can respond to trauma, whether in your own life or even in the lives of others who come to you. When we want to go back to, when we talk about trauma, when we talk about crisis, let's go back to basics, let's go back to the origins and also wonderful ancient knowledge which is the truth as well. So we see here, we can actually learn a lot about crisis management. You can see from Nabi Nuh's unwavering faith in the face of a flood. We can see Nabi Yunus' patience, in all that he was going through in the belly of the whale. Nabi Ayub suffered a lot, and his steadfastness through that unrelenting illness and losing everyone in his life. And that was beautiful to see how they were able to have resilience. That's a very common denominator here. And they trusted in God's wisdom, enduring with hope, no matter what the hardship. I think we need to think of these wonderful people as some of our wonderful heroes as well in our life, to really bring that encouragement and reminder to us. So it is not to compare, but it's more of an inspiration that, God willing, we can even emulate that wonderful resilience. In counseling, when I teach counseling techniques, right, there is a part here that talks about the soul wound. And I love this part because this is the part that really touches on soul, and also the wound and the pain of the soul and the trauma. So before I go further, right, can I ask you to type in the chat box, what is the first word that comes to your mind when you hear the word trauma? Can you type in the chat box? What is the first word that comes to your mind when you hear the word trauma? Can you type? Pain. Okay, thank you, Madam Raini. Distress, tragic experience, pain. Yes. Dr. Fatima. Okay, Aisha says anxiety. All right. What else comes to your mind? So yes, you're right. Pain, anxiety, fear. All of these are very accurate and very good. Very, very afraid. True. Trauma makes us feel anxious, fear, because there's uncertainty there. We do not know what's going to happen. It's a disaster. Exactly. It's the unknown. And sometimes the unknown can be scarier than really facing reality itself. So it's a tragic experience, true. And it says here in counseling techniques, right, when you want to understand the soul's wound, think about, if I can invite all of you right now to think about some experience that you've had before in your life that was very traumatic, or maybe God will, thanks to God, if let's say you have not had a traumatic experience, maybe a painful experience or something sad that happened to you. Can you think about that right now? And think about it at the moment. How does that feel like? And how did that feel like? So when you're trying to understand the soul's wound and trauma, you need to become aware of it and know that sometimes there is an intergenerational trauma. Sometimes it can actually, in psychology, we'll call it like some predisposing factors and also some biological factors that we can see as well, trauma. And it's interesting because trauma and crisis and all of these hardships sometimes occurs in the soul. It starts there. And we need to understand how it starts in the soul, or in Western psychology, right? They call it or in the soul or in the spirit. And I love that this particular book talks about that, actually, because we need to acknowledge the source of that trauma. And we know where it starts, right? It can manifest in different ways as well. What you typed in the chat box, all of you, are manifestations actually of trauma. It's very, very true. Some of it, trauma can manifest emotionally, some of it can manifest physically. So I'm going to show you more about how the manifestations of trauma actually happens before we go into the how, right? So let's first lay down some cards right at the moment. Crisis, trauma, and grief. What exactly are they? Are they the same, you think? They're definitely overlap, but they're not the same in equivalence. So crisis usually precedes trauma. That means usually before a person feels trauma, that means before you have a traumatic experience, there needs to be a crisis first. That's why you have the result of it is that trauma. So crisis is actually something that comes before trauma. Trauma is your body's natural response to an overwhelming event. So sometimes you might think, why is this? Let's say, for example, you know a friend or a child, a daughter, or somebody's child, let's say a teenager maybe, and they come to you and they say that I cannot go on with my life. I had a crush on this guy, and now I noticed that he already has somebody else, and they are a teenager. And sometimes we might feel anger or judgment, or we might feel like, why is this person, this teenager, actually making this their whole life and wanting to give up on their life for this particular reason. But we don't understand that their worldview at that moment, that issue is huge for them. So trauma is different for different people. The crisis can mean different things for different people. For us, that might not be a big crisis, but for that person, it is their whole world. So we need to make sure that we don't generalize that particular response, because everyone's response is different. So trauma is a natural response that you might feel, like facing the floods right now in Malaysia. That can be traumatic. The crisis is the flood. The trauma can be feeling that fear and anguish and sadness, responding to that after going through that. And grief is a normal process that involves psychological, social, and somatic reactions. That means psychological is like extreme sadness. Social can be you want to stay away from everybody. Somatic is you feel like something in your body, right? So palpitation, your hands are sweaty, you can't sleep at night, you can't eat. So that's actually a little process of grief, actually. So you can see that some of the reactions in grief can overlap with depression as well. But grief is very much a huge process of loss. There is a loss that you are grieving. People going through natural disasters are grieving the loss of their things, maybe their property, their stability, their security, and maybe even the loss of a life sometimes, So grief is not only losing someone's life, but it can also be losing a relationship, losing a friendship, the end of something that meant a lot to you, losing a job, losing something that meant a lot to you. And crisis actually is a situation. It creates great difficulty for someone. Trauma is the aftermath of that crisis, and grief is reactions and perceptions to loss that can be in psychological, social, and somatic. How many of you, and by the way, I love Zoom because you can personally DM me right over here in the chat box. Please share with me. I like to hear from you as well. Can you relate to any trauma or grief in your life as well? And you don't have to share in the main chat room. You can personally message me as well. So I feel like this particular experience, draw on that for today's talk, because then you can relate to that and what we're trying to say here. Thank you for sharing with me in the chat box. Thank you. So trauma actually is a Greek word that means wound. And there are 3 E's in trauma that they say here that is very useful for us to understand, So first is the event. Okay, the threat, the crisis that actually threatens us. Next is your experience of that event, how the person labels the meaning to that event, and your perception, of the individual. And effect is the result of that experience. So say, for example, somebody loses a loved one. It's very traumatic. And the experience is actually that you feel like, how can that happen? I feel like I can't go on without that person in my life. And then the effect is that you can't really cope. And very often it can overlap with that grief as well here. So grief is that emotional pain. It varies by individuals and loss. And you can see physical effects, you can see cognitive, behavior, and social and spiritual aspects. Okay, I like what somebody put in the chat box, that losing a love that they never had is also a grief, because they loved somebody but they never got to be with that person. And that is also a form of grief as well. Yes. So sometimes grief can mean different things in different ways. But it basically is something that affects you physically, cognitively. Somebody being abused as a child, you're grieving the loss of that innocence that was taken in a way, or you're grieving the loss of that personal, protection that you were supposed to be given. So that can also affect a person physically, cognitively. So it mostly, if you want to differentiate between trauma and grief, it's more of grief talks about that loss, and trauma may not always involve a loss, but it is a traumatic experience. And when you want to help someone cope with trauma or grief or a crisis, sometimes people say, time heals all things. Have you ever heard people say that before? Time heals everything, it's okay, you get over this. But sometimes there is no proper expiration date for it. And even if we are able to cope, there are some days that you can go back down. If I can share my personal experience, and I hope that you can all also type in the chat box as well. All right, you can DM me if you prefer. So recently, I lost a very, very good friend who passed away, and that was very traumatic for me because I did not immediately find out and get the information. I didn't know until about a month later. So it's painful really, because I didn't have any mutual contact with that person. So the grief was painful. It was so low. Some days I would go up, and then having social support system, having spirituality in my life, having that, all of these factors helped me a lot. So I would go up, and then some days you find that you relapse back and you go back down. Then you go back up again, and then you go back to square one. Then you go back up. But the surety that I can see, if you actually get help, eventually you would be moving, hopefully, in an upward spiral. Hopefully, right? So the expectation is that we go through grief perfectly, perfectly in a straight line. It's never so straightforward, usually. It can be up and down as you go there. Thank you so much for your message. Yes. All right. So I want to ask all of you about this particular picture here. All of us have been through different types of grief, and I know that, or even traumatic experiences, and I know that these pictures here may not all symbolize what you've been through. But if you had to choose a picture, the one that you could relate most to, what would be your number? So the first one looks like I'm thinking, okay, somebody who is going through this is a lot of stress, a lot of trauma. You do not know how, so overwhelmed. The second one is a heartbreak. The third one is financial issues. The fourth one is deep grief of losing something very close to you. Can you share with me your number? Which of these pictures can you relate most to? Thank you so much for sharing. Okay, 4, 3, 4. Yes, 4. I think I can relate to a lot of that as well. 4 and 3 sometimes, yes. A lot of us feel that 4, yeah. Anyone else? Anybody feels that overwhelmed feeling? I mean, when I think of overwhelmed, it reminds me of number 1, like you're just so overwhelmed. Number 2 as well. Thank you so much for sharing. 4, 4, 4, 4. Exactly. So a lot of us can relate to that deep grief, right? I'm glad that you're sharing, and I really thank you. You can see that this chat box is like a shared space. Now we have a shared space of grief now together, all right? And sometimes when you have that, it's a beautiful healing that comes about. Thank you for sharing, Zainuddin as well. 2, 4. Anybody, 1 here? You feel like overwhelmed, too much stress as well. Can also be 1. So now that, okay, 3 and 4. Can I ask you a question? Coming to this slide right now, who do you think, thank you, 1 sometimes, yeah, exactly. Who do you think is in a crisis? Can you guess? What would be the number now? Who do you think among, okay, three, 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 one. Okay, yes. Two. Interesting, Nasser. Yes. Who else? Two, 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 three, four, one. And the answer, actually, yes. Thank you, Farida. Okay, thank you, Hassan. Right. Four also can be. Yeah, I love you guys. Actually, you're right, Madam Raini. Yes, all four can be in a crisis. Actually, you are right. Thank you for the direct messages. Yes, 333. You are right. In fact, all of the above can be people in a crisis. You know why? Crisis does not always look like number three. Sometimes it can look like number one. They look perfectly fine on the outside, but look at their space, their home, when you enter their room. Sometimes it could be, I'm guilty of that sometimes, too busy, but sometimes it could represent your mental space and your emotional space as well. And crisis can look like that. And then sometimes it could look like a smile and a laugh. You know what they say? The biggest clown in the room sometimes is the person who's really suffering a lot. Sometimes it could be someone who is so close to us, our friend or anybody that we know who's so successful, but yet they're suffering. I want to share this with you to tell you that a successful person, it does not work like a, like a weighing scale, the more success, the less mental health issues. No, the more you're perfect in every single holistic way, biopsychosocial, spiritual, the less the mental health. Not necessarily. It really depends. Yes, exactly. Some people mask themselves by smiling or laughing. Exactly. So we need to identify because a lot of times people look like the picture on the left. What we don't see behind closed doors is the middle picture. And what they're really, really going through is the right picture. You never know that your help today, the skills that you give, can actually be helpful for these people. Can you look at this particular slide right now? All of these are some symptoms of trauma and also being in a crisis and also even grief as well. So later you can share with me also, right? All right, you can tell me which can you relate most to. Is it deadlines? Is it fatigue? I remember when I was so stressed, sometimes it can really affect your brain. Do you realize that? Do you know emotions are not just got to do with your heart? It's really very physiological and neurological. You can really, if you were to put in an MRI scan, you can really see which parts of your brain light up when you're happy, when you're sad. So when a person goes through trauma and sadness so much, their left prefrontal cortex is affected. You can see different parts of their brain are affected, and it really affects how they function. This prefrontal cortex here is very responsible for our decision-making skills and problem-solving skills. So that's why when you're in a trauma or sadness, you can't think straight sometimes, and you end up making the wrong choices or even saying the wrong things. So if you know someone in a crisis and the way that they are speaking does not make sense, it could be because of this. If they can't sleep, if they can't, some people tell me, Pam, I have no problem, but I can't sleep. I just can't sleep. I just cannot at all. When I really talk to them, then they share with me, actually, I'm very worried about my daughter. I'm very worried about my children. I'm so worried about my divorce. So there are underlying issues, but they're so high functioning that they're so carefully able to bury it. That's what we need to be careful. So they surface out and manifest physiologically. These are the high functioning people that I can notice. Mine, okay, if I can share with you, some of my friends know this as well. When I was going through that grief, I was really busy with, I needed to finish a lot of work and I needed to function. So I was able to try to use the skills, whatever knowledge that I have to cope with it. But I think I also tried to maybe suppress some parts of it. And when I tried to suppress some parts of it, what happened was I started having physiological responses. I remember I was having indigestion, and for me, it was showing up in that way. So it was really not easy. So in a nutshell, these are some of the common physical, emotional, cognitive and behavior, and even spirituality factors. When someone is in a crisis, they start to feel physiological responses. Do you know that people who are in extreme stress, it actually can make your blood platelets sticky, And it can actually make your blood pressure go up because of that. Do you know when you're in extreme stress and sadness, it can even constrict your blood vessels? So that's why some people get this cardiovascular issues even from that stress as well. So that's how it can work, even for sadness. And your emotions can be affected, and even some people, it can even shake their spiritual belief as well. So I want to come here and share with you how, okay, let's get to the meat right now. How do we actually help someone in a crisis? I want to share something with you. And yes, you can feel free to share your in the chat box. Yeah, any questions that you have, I will come to you as well. I just want to share something with you. Let's imagine that someone who's going through a crisis is like an unlit candle. I don't know if you can see this. An unlit candle, okay, over here. And they're in darkness. It's all dark. It's very hollow. It's small, and they isolate themselves. But they have the potential to shine. They just don't have the capacity to do it anymore. So they need a little bit of help from a lit candle. Okay, this candle is dimly lit. It needs a new battery. Okay, but it's ultimately a lit candle here. And that's you, all of you. If you, this person with a lit candle is actually in a position to help the person with an unlit candle, which is actually symbolized by an unlit candle. Now, all of you, if you are in a position to help someone who does not see the light at all anymore, you can actually be surprised how reaching out to them for a little bit and using the right skills can really help pass the torch and really help lighten their load and even create a spark for them. Sometimes all they need is a little bit of light from you. And once you do that, when they are strong, hopefully one day they can then pass the torch around like a domino effect to the next person, like a beacon of hope. So it becomes a chain of hope, really. So remember, the interesting thing is when I actually light this candle with the other, right? This one that is actually having more potential, and I light this one actually lose its brightness. It does not. In fact, the room becomes brighter because now you have double light. So that's what you are, actually. All of you are beacons of hope and candles. I want to share with you how important your role is here today. Because an example of this, there was once I received this note at my office door, and it was from a student. And she said this. She actually said, I've thought of taking my life away, but you are the reason I wanted to stay the next day. And this is not only for me. A lot of my colleagues today in the chat box as well, even Madam Raini, a lot of others at our department have received notes like this. When you actually are able to just give a little bit of moment to that person and share a little bit, you would be surprised how a little spark can really, really ignite that passion to live another day. So that's what I want to share with you, right? So let's go into how right now. Let's go into how together. Okay, coming back to the how. So first of all, I really love these core themes and teachings from Risala Tenor, and these are by Said Nursi's teachings. So he says that hardships are transient and they serve as tests for spiritual growth. You know, if everyone had it easy, you're not going to grow spiritually, emotionally, personal growth, psychologically. This world that we live in is a guest house. We need to remember that we are visitors passing through. Focus on the eternal destination because this is not our forever. Hardships are part of God's plan and they have hidden wisdom. It might be hard to digest this sometimes, but it's the truth. And it helps for us to know that, right? A believer knows that whatever comes from the divine is good, and pain is a form of purification. Suffering can lead to closeness to God. And this is very true. When I was going through that trauma and grief, I really felt close to God, actually. I felt like I was able to be more empathic to others who are going through trauma as well. And it also made me more in tune with God, and I wanted to really focus on Him. And it's just wonderful to see how the growth that happens in you. Calamity brings you closer to God better than a blessing that distances you, right? Sometimes when we're so busy with all the happiness and all the goodness, we sometimes fall into the trap of accidentally forgetting to be closer to God, even to look at the pain in others. Gratitude then shifts focus from loss to blessings, actually. So every blessing that we receive is a responsibility to be thankful. A blessing for me today is to talk to all of you. Honestly, I love and I'm so happy being able to share and talk to all of you and interact with you. And this is something that I'm thankful for. So in Surah Asha, I think a lot of you know this, 94, 5 to 6. Indeed, with hardship comes ease. And this verse is very pure and beautiful. There are so many other beautiful surahs, by the way, that commonality you can see is that trials and hardships test our faith, purify the soul, and strengthen the reliance, right, on God, with the assurance that He does not burden anyone more than we can bear. I think we heard this. There's also lots of research, and I want to share with you one of this research here that integrated Islamic principles in a community-based program. I like this keyword here. They normalize trauma experiences. The keyword is normalize. A lot of times when we see someone cry, we feel it's abnormal and we tell them to stop. Don't cry, don't cry. It's not bad. I used to be that way too. But when you really learn about this, you realize that embracing that sadness is the first step towards going forward. It's the first step towards having joy, and it's the first step towards healing. You got to know this word, everyone. It's called catharsis. Sometimes crying and sadness can be very, very cathartic. All right. And there is, okay, the first thing that we need to do, everyone, when we want to help somebody, mental health stabilization. There was once we had a student come to us at our place, and the student was hyperventilating. She was having this anxiety attack, and she was going through this terrible traumatic experience, and she was definitely in a crisis, and she could hardly breathe. She was like panting, and then she said, I don't know what to do. She couldn't even speak, actually, and she was just crying and panting. And then we came and we helped her. And the first thing that you can do to help somebody is to stabilize them. We call it mental health stabilization. That means we help them to get from a crisis to a non-crisis mode. That means now they're in a crisis. You can't talk to them at that moment. I mean, you can't expect a reply from them. You can't say, tell me what happened. They're not able to. So the only thing we can do is, what I did with her is I brought her to a room, a safe space in our department, and I sat her down together with our head of department, and we talked to her, actually. And we said to her, okay, I want you to follow this. Can you just come? Can you sit down first? Let's breathe together. That's one of the first things that we did. We tried to stabilize the person, because if they are not able to speak, one of the first things that we need to do is to first stabilize them. I will share with you this one when they are able to speak. But before that, we really need to just stay with them and be silent. Sometimes just you sitting with them is already so helpful. Just being beside them. And if you see what Imam Al-Ghazali said, sometimes the useful thing is just silent. Be silent. Have a natural break from that. Remaining silent can be appropriate, sometimes for deep reflection. Create a safe space for them. Can you relate to a time when you were with someone and you didn't know what to say? Sometimes it helps to just be with them, and you can even be honest. Remember the video I showed you last week? You can say, I don't know what to say, but I'm so sorry you're going through this. Even just saying that, or even just keeping quiet, that's what we did. We kept quiet, and we just kind of told her to breathe. And that's what helped a lot over here. I'm going to share with you 2 techniques, everyone. One is deep abdominal breathing, and one is grounding. Okay, so for the first one that I want to share with you, okay, deep abdominal breathing. But first off, we need to be going back to basics first. Okay, everyone, can I ask you to do something for me? Can you sit back comfortably? Are you comfortable? Can you sit back comfortably? All right. Now put your left hand on your chest and your right hand on your tummy, or your stomach area. So the left one is on your abdomen here, on your chest, and the right on your tummy. Now I want you to take a deep breath and exhale. Can you tell me, when you took a deep breath, inhaled, right? Did your left hand go outward or inward? How was it? Do it again. Type in the chat box. Take a deep breath, inhale, and exhale. So when you inhale, it went inwards. Okay, now tell me what happened to your right hand on your tummy. When you inhale, did your tummy become bigger, like it's expanding, or did it go inwards? When you were inhaling, inwards. Okay, so the correct way that I want to share with you, the deep abdominal breathing way that will help you get more oxygen into your body. When you inhale, the correct way actually is for your tummy area, right, to actually go outward, actually, the correct way. And yes, Aisha got it, expanded. Yeah, tummy expanded, correct. When you exhale, your tummy area is going to go inward. Think of it as a balloon. Can you see this balloon? Haven't blown a balloon in many years. So I'm gonna blow this. Now imagine you are inhaling. This kind of expanded, am I right? This is like your lungs. Actually, this represents your lungs right now. And now when you inhale, it gets bigger, right? The whole abdomen, every part of it, that's why I call it deep abdominal breathing. Every part, there's lots of air filling up your lungs. When you exhale, oops, embarrassing sound, sorry. Okay, so when you exhale, it actually is going to get smaller. So this is a part that all of you need to learn, because you can still breathe and be alive, even if you do it the opposite way. But you won't get as much breath. So this is what we did with her. We told her to breathe in and breathe out, but using the deep abdominal way. Can we try this together, everyone? I'm going to give you a technique, and it's called 4-4-4-4. So 4 times. And it goes like this, okay? Inhale 4 counts. Hold 4 counts. Exhale 4 counts. Hold 4 counts. Okay, Dawood says, tummy inward, exhale outward. Inhale. Wait, I got confused. Inhale, inward, exhale. It's actually, yes, correct. Outward is for inhale. Yes. Inward is for exhale. Correct. So let's do it together. 4 counts of inhale, 4 counts of hold, 4 counts of exhale, and 4 counts of hold. I'm going to show you how to do it, okay? Let me guide you through it. Let's put our hands on our tummy right now. Only our tummy. Breathe in. Tummy expand. 3, 4. Now hold for 4 counts. All right. And now we're going to exhale for 4 counts. Now hold for 4 counts. Why do we have this hold? The hold is actually to allow that oxygen to travel in our body. And then it really helps you a lot. Let's do this together with sound, shall we? Okay, I'm going to come here right now. You can follow this, okay? So everyone, can I ask you, let's do this together. Oops, sorry. Get ready, gonna breathe in together for 4 counts. Can you hear the music, by the way? Can you type in the chat box? Okay, now hold. Okay, breathe out, 2, 3. Now hold. Breathe in, hold. Now if you can, ignore the screen and just close your eyes with me. Now that you know how to breathe, practice that. But when you breathe in this time, I want you to imagine that you are breathing in good energy, and it's traveling to every part of your body. And as you exhale, exhale out all that stress, all that sadness, anything that you've been penting up. All right? So breathe in once again. Inhale in all positivity. We have a very positive energy today. Inhale it all in. And now when you allow it to travel to your body, and as you exhale, exhale out all that sadness, all that grief and pain and trauma. And keep doing this a little bit more. And hold. And breathe out. All right, now I'm going to bring your awareness back to our session now. Okay, how did you feel, everyone? If you could describe in one word how you felt. I felt a little relieved actually talking to you all and doing it together with you. A little bit of peace and joy. How about you guys? Okay, some of you said that you feel calm. Some of you said peace. Some of you said it gave you relax and relief. Imagine doing this by yourself. It's really different, by the way, if you do it alone. You really feel you can concentrate better and you really would be able to get into the zone. I did this actually with that student. I told her to imagine Fort Dixon, actually, a beautiful place in Malaysia. So I told her to imagine that you're by the beach right now, and I played beach music for her. And I said, let's just go there. Can you see the beach? Let's breathe together. We're both there and we're walking by the sand. So our mind, the way God created us is so powerful. The way our mind we're able to see without actually seeing something in the physical realm, but in your mind's eye. I teach sports psychology. There's a concept called the mind's eye. So it means that you're able to visualize it. That's how powerful the brain God has given us. If I tell you to think of an apple right now, did you see an apple? What color is your apple? Mine's red in my mind. That's how powerful. So you can bring yourself to peace anywhere, even in a crowded place, even in a crisis, you can go to your happy place. And that's what we did with her, a stabilization technique for her. Okay, another way to stabilize someone. This is called grounding, by the way. All right, fresh and relief. Thank you. Yes, relax. Grounding is like this. Ground means you feel the earth. It's kind of like earthing you for a bit. It helps you to be present in the here and now. Do you know when, say, for example, I really got a client actually. She was sexually abused when she was 11 years old. And she was in the house. It was by her uncle, and she couldn't escape anywhere. And that traumatic experience of not being able to escape anywhere, as an adult, she felt anxiety whenever she's in the escalator, whenever she is in a flight, whenever she was in a traffic jam, that concept of not being able to escape. Once she was at Batu Caves, so then she got lost over there. She couldn't find her parents. That also gave her an anxiety. So now as an adult, she's working in a beautiful corporate company. She cannot enter the lift to go up to her floor. And she's a manager, by the way, a wonderful person, very spiritual. And she cannot, whenever she wants to go to her 30-something floor, she has to wait for somebody who hopefully will also be using the escalator at that time, the elevator, sorry, at that time. And then Baru, she will go inside. That's how much the anxiety was. And what we need to do, we needed to do is to actually bring her to really ground her towards the here and now. So one of the things I helped her was in grounding. Another thing, of course, was in helping her to revisit her past. But you don't have to do that right now. What you need to do, your role is help the person to ground, to feel grounded. And that's a very helpful technique because you really help them to be present in the here and now. So how do we do this? There are 5, 4, 3, 2, 1. Okay, so you can tell them, because when she's in the elevator, she gets the flashback. Oh my gosh, I cannot escape. It brings her back to that 11-year-old girl again. So now she's revisiting and reliving that trauma. Help the person to be grounded on the here and now. So I say to her, okay, can you focus on 5 things you can see? Tell me 5. So she's hyperventilating. 5 things you can see. Can you name 5 things you can see? Let's say, for example, if they're capable of doing that. If they can't, you need to do the deep breathing first. So now they say, okay, name 5 things you can see. Everyone, can you do this together with me? Tell me 5 things you can see. Like, for example, mine will be fan, computer, aircon, and then table, for example, right? And cup. So 5 things. Can you name 5 things you can see? And then, consequently, you tell the person, can you name 4 things that you can touch? So, okay, I'm going to touch my phone, going to touch my computer, going to touch the light, the Tupperware, for example. Yes, thank you, Dr. Fatima. Glass, laptop, lamp. Then you go to 3. Name 3 things that you can hear. I can hear the fan, my voice, and birds, for example. Name 2 things you can smell. Yes, smell. Hopefully something good. Okay. I can smell my room, my air freshener, my perfume. Name 1 thing you can taste. So this morning's coffee, for example. Why are we doing this, everyone? There is a science behind it. by the way. The science behind the grounding technique is it really activates your prefrontal cortex because now you are bringing the attention to sensory details. You are shifting the brain from the amygdala. The amygdala is very activated when you're emotional. It shifts it to the prefrontal cortex to activate this part to think clearer. Remember, I shared with you the prefrontal cortex is in charge of decision making and problem solving. So then it also engages the parasympathetic nervous system. This parasympathetic nervous system, PNS, right? It actually helps you to be peaceful and calm. It counteracts the stress part. And also, when you do grounding, it helps you to really engage the sensory input. You have a thought stopping technique. You block it like a traffic light. All of a sudden you hit the red light. Now let's go into yellow. 5 things you can see, 4 things you can, so on and so forth. So you're actually going to yellow. Now you go to green to be peaceful and carry on with your day. Truly, I tell you, try this technique when you're very stressed. Then you can see the shift in it. Try it when you're very angry as well. It's really helpful. All right. I would like to share with you some final parts here. The essence of oneself is really likened to a perfect mirror, which, if polished, would then reveal one's true divine nature. This is from Al-Ghazali and The Alchemy of Happiness. So really you can see that the essence of you is like when you're polished, a mirror that's polished, that's how it will reveal your true divine nature. The crisis that you feel, the grief that you go through is now slowly showing your divine nature. And that's beautiful to see that, right, everyone? Okay, so thank you so much, everyone. Salam. I would love to hear from you if you have any questions that you would like to ask or anything that you would like to comment as well. You can also private message me if you want it to be private also. So can I hear from you? I'm just going to take some questions now.
To all participants, you can have a question Q&A or you can write in the chat box. If you want to have question, you can raise up your hand so that I can unmute you.
Thank you, Madam Aini. Thank you so much. So any questions? You can also DM me, by the way, so that it's private if you want to. Thank you so much. Thank you, Aisha, yes. Thank you. Okay, as a Muslim psychologist, do you think there are personality disorders that are incurable? For context, I work in a family court here in the Philippines, where most non-Muslim psychologists who testify before us claim that their clients suffer from personality disorders, which they classify as grave and incurable, no matter the intervention. So they use this as supporting evidence to have their client's marriage declared void. So antisocial disorder, personality disorder, narcissistic personality disorder. So that's a very good question, by the way. Can we actually cure a personality disorder? And do we even use the word cure as well, right? It's just like saying, can we actually cure a physical, very, very debilitating physical illness? So the answer would be, our responsibility, it's not to say that we are, something is going to be cured, but we can definitely help the person to have the resources to deal and manage their symptoms. I wouldn't say it's incurable. Yes, someone with a personality disorder has developed it, and they can actually exhibit it because of family background issues, trauma, and everything. Some people have borderline personality disorder, and all that. So I would say that it's not to say it's incurable. I wouldn't look at it in that way, like a fever. It's more that, yes, the person lives with that disease, but they can actually get help to address the symptoms as part of the illness. They can definitely get help to manage those symptoms. They can. Whether they will suddenly be completely without narcissistic personality disorder, maybe it's not exactly in that way, like as simple as a Panadol for a fever, but it's more of like they can be helped, definitely, to be given the right resources and help to help them manage their symptoms. So yes, it can. Actually, it's possible. So if you would like to use the word, don't use the word cure with them. Say that their symptoms can be helped and managed if they want to. All right. Thank you so much, Alamin, Yusuf. Okay, I got a very nice direct message. How to help my hubby's anger management. he's not open to therapy or counseling? That's a very important question, especially when the person is not open to therapy. That can be very challenging, right? For us to actually, we can't force them. So I would say, if they're not actually open to, maybe he's not open to counseling for his anger, but you could actually propose to him, would you like to see a couples therapist? Maybe a couple therapist can help with our, improving our communication. So don't put it as to help with your anger. Maybe he feels defensive and he might feel angry, like people are gonna find fault with me. So put it in a way that, would you like to go for couples therapy? Of course, he would decline at first, but as you slowly talk about it, when he realizes on his own that his anger is controlling him, not he control his emotions, he will get help, actually. It's better that the person wants to go on their own rather than we force them, because then they'll be cooperative. But you know what? Don't give up in that. I've seen husbands where they refuse therapy, and in the end they realize it's not helping their current behavior. It's not actually working out. They will then go for therapy. So in the meantime, you can help them be calm by using these strategies and talking to them, and being helping in that way. But have your boundaries as well, because you also are a person who is of worth, right? Okay, I got a very nice experience here. I have experienced a situation when I felt so weak and I cannot breathe. Even I could not hold the mobile phone to make a call. I just short of breath. Later, I will always feel the same when seated in the AirAsia flights. So uncomfortable. Luckily, the flight took 55 minutes. Thank you for sharing that experience. I think that this is a very, very common experience as well among people with anxiety symptoms. My own very close friend would always call me when she's on the flight, because of the exact thing that you're saying. You feel so weak and anxious. So what I would recommend to you, it's really good if you can talk to someone. You could talk to a professional about this. Try to talk to a psychologist or a counselor and find out, because that person will help to find out what are the underlying triggers for this anxiety. What about the flight scares you? Because it's not just fear of flight sometimes. Sometimes there's an underlying issue. Like my client just now, she's not afraid of airplanes only. In fact, she works for one of the airline companies. And she has anxiety flying. That is not about the plane. It's about her abuse and being in a confined space where escape is not possible, which she actually experienced when she was 11 years old. So when she got therapy and we talked about those underlying root cause of that fear, then it kind of made her braver, and she was able to look anxiety in the eye and now be able to actually address those and manage those symptoms better. So it's really good if you can get some help.